I think, and I believe, and I see that it is my ticket to early retirement. But there was a time when we were growing the medical that I couldn't take any new patients because I was having to focus my attention on the medical growth, which is far more profitable. In a sense, it's opened up a lot of opportunities for me to, number one, enjoy more freedom of time and money, and number two, looking at the future, going, okay, I've got a little something on my hands here that is going to be worth a good amount of money to sell when I'm ready.
Welcome to ChiroX, where we talk business growth for, well, chiropractors. That clip tells you everything you need to know about today's episode: profit, scale, and freedom. Most chiropractors cap their income and their time by relying on only adjustments. Our guest cracked the code by adding a medically integrated model that doesn't just treat symptoms, but built a multi-million-dollar asset. Today, we are joined by Dr. Joe Denke, who is the founder of Select Spine and Sport Medicine. He's here to share his blueprint for legally adding MDs and $1 million in revenue in your practice without sacrificing your philosophy. We're going to cover everything from the simplest way to start an integration process and all the steps along the way and how he built his own practice. Let's dive right in. You are tapping into a topic that I've never covered on this podcast show, and I want to kick things off and dive right into it just so we can add value as quickly as possible. Can we maybe talk through what exactly is a medically integrated chiropractic practice? And also, like, what were the stepping stones that got you even going in that direction? Because for me, it's something I've never actually even heard of until talking to you, but it sounds like more and more doctors are deciding to do it. So you mind first maybe explaining even what it is, and then number two, how you got into it?
It's something that I kind of always wanted to do whenever I started my own practice. Whenever I created the name, I didn't even put chiropractic in my business name. My business name is Select Spine and Sports Medicine. So immediately it was something that was on the back of my mind. And over the years, building up the chiropractic, eventually got to the point where Texas changed some laws where chiropractors could own a majority stake in a medical clinic. And whenever I found that out, I was like, okay, I gotta figure out how to do this now, because I know I had a friend in another state who went with another company, and you got to go through the company, and they hire the medical director, and they hire the nurse practitioner, and you got to do this MSO plan and all that, and it just sounded too complicated and too risky. So I have a friend who's a nurse practitioner, and we coached our kids baseball together, and he worked at an urgent care, and he said, hey man, if you ever want to do anything together, let me know. And he was a patient of mine too, and just kind of the perfect storm, all that came together. I was like, actually, I do. Let me look into this a little bit more, and let's see what we can do. So got with a healthcare attorney, and he informed me of the laws that chiropractors can own up to 95% of a medical company. And so he was just able to put together these contracts for me, where I'm a 95% owner on paper. In reality, I'm still the 100% owner. The medical director is the 5% owner, but has no profit share, no say-so in the business. He forgoes that, again, on paper, for a guaranteed salary for his medical directorship. So we have the nurse practitioner in the office, and the way that we run, there's many different ways to run a medically integrated office. Some practices, they'll bring the patient in, and that patient will see the nurse practitioner or PA first, all patients. And they'll do an exam, and they'll bill for that exam, and then they will direct the care to the chiropractors or to the other practitioners in the office, physical therapy sometimes. I also didn't really like that because I do have a name in the town where people want to come see me. So I didn't want to make it a barrier to see me. So I wanted to add services to our office to build our services, build our profits without people having to see me. Kind of at the same time, medical weight loss was getting to be popular. The IV infusion therapies were kind of already popular, and so we started with that, and then have added on to it.
Just so I'm understanding it correctly, and also the listeners understanding it correctly. So basically, you have an MD that has 5% ownership, quote unquote, on paper within the business, which allows you then to be able to provide medical services within the practice. Is that correct?
Absolutely correct.
What is the advantage then, I guess, to the MD to doing that? So if they only, I mean, they own 5%, which I guess is technically equity within the business, they would still get a portion if you decided to sell the practice, right? Like what's in it for them, I guess.
No, they don't get anything. They sign contracts basically saying that they forego profit share, they forego equity. The benefit to them is they're getting paid a salary based on their for their service to the business as being the medical director.
So they're on staff.
Correct. That fee for them can be anywhere from $500 to $3,500 a month for oversight to the nurse practitioner. In Texas, nurse practitioners need a medical director. They can't do anything on their own. So our medical director provides directorship to our nurse practitioner, and he offers standing orders to the staff. I have medical assistants now too. So he provides that service to us. If I decide to fire him tomorrow and hire another medical director or move in a different way within my company, I just notify him, and that's the end of it. He gets no buyout, no nothing. So there's no risk in it for me and nothing else in it for him except for the monthly paycheck.
And then if he leaves though, then do you need a different doctor to retake that 5% within the company? Or is that just like the paperwork's done and it's
Correct. Yeah, and that's already happened actually twice, and I have no problem with that. There's a lot of MDs out there that will do this as a side hustle. There's companies out there that will help you find medical directors. You can even do it on Indeed. And I mean, I've had people just about knocking the door down saying, "Oh, yeah, I'll do this for you for X amount." It's not hard at all.
yeah, because really they really don't have to do much and they get a nice little side paycheck really at the end of the day, right?
Exactly. Exactly. I think, to my knowledge, in Texas, one medical doctor or DO can oversee seven mid-levels at a time. So there are MDs that literally have stay-at-home jobs collecting checks once a month just for sitting at home on their computer reviewing charts or talking to their mid-level, making sure that they're doing things the way that they should.
It's actually kind of silly, but it's cool, but also lame at the same time. Like it's cool in the sense that you're able to partner with a MD and be able to offer additional services as a chiropractor, but it's also lame that as a quote unquote doctor that you're not able to just do that on your own. We don't have to dive too deep into the general scope of I guess the United States, but you mentioned that it's a thing that's kind of recently, more or less within the last 3 years, happened in Texas. Is that true across the states? Because I actually remember talking to a doctor out in Florida who he's doing something similar. I think they're a little bit more leeway in Florida, but generally speaking, you don't have to go like state by state. But like, what does it look like in the scope of like the United States?
Yeah, I'm really not sure. I had a friend in Louisiana, and things were different for him when he did it. And he had to set up a whole nother MSO company, and he was his chiropractic business was the management company, and then they had the medical company on the side. Um, I really only know exactly how it works in Texas.
Well, let's assume that the listener that they are allowed to do it in their state. Let's get practical for a second. Is like, what's the simplest first step somebody could take to get medical integrated practice, and like, what is some of the common mistakes that people make when they try to do this?
So first step is get with a healthcare attorney. I just talked with a former classmate of mine and gave her the info to the healthcare attorney that I used. So you get with them. They, what do you want? What's the goal, right? And then they draw up the contracts. And then next step would be you find your medical director. Again, there's different avenues for that. So you can do that on Indeed. You can do that through medical director finder companies. There's lots of them because nurse practitioners and PAs need this as well. So there's lots of companies that service that person. Once you find that, you meet with that person and that MD and say, these are the services that I want to provide in my office. Are you good with that? Are you good with this price? This fee per month for your service? Okay, then you send them over the contracts and get going. Probably the hang up or hiccup that I could see was that I had personally is getting a medical director that was willing to help me, to willing to grow with me. Like I said, when I first started, we were just doing the IV infusions, little weight loss shots, little wellness stuff. The nurse practitioner, a friend of mine that started with me, he was well versed in urgent care ER, so he could do pain stuff, pain injections, anti-inflammatory muscle relaxer prescriptions, things that I used to refer out to an ortho or urgent care for. But that first medical director, that's all he wanted to do. And so when I was ready to grow into additional things, weight loss, testosterone therapy now, peptide therapy, they cut me off there and were like, I'm not really wanting to get in that. I'm not well versed enough in that. So I can't help you there. So at that time, I just found somebody else who was versed enough in that and willing to help me grow into that. So that was my first hiccup.
This might be a silly question, but does it make sense to have multiple medical professionals in the clinic then? If they like, if one is more suited or skilled in one versus, like you mentioned, the peptides, Ozempic type stuff is like, if someone's more skilled in that versus something else, does that, would you have multiple doctors for something like that?
Multiple medical directors, no, that wouldn't be necessary. You only need one, and you'd really only want to pay one. But let's say eventually I got big enough to where I wanted to have multiple nurse practitioners, multiple mid-levels, because those are really the workhorses in this anyway. Then sure, I could have a nurse practitioner who was good with hormone replacement therapy for men and women, or one for men, one for women. One that was better at joint injections or trigger point injections, but didn't know anything about peptides or hormone replacement therapy. Then I could see offering that where, maybe one came in Monday, Wednesday, Friday and did this service, and another one came in Tuesday, Thursday to do another service. Now, going back to the payment of the medical doctor, they would have to then oversee two nurse practitioners. So your fee to that person would have to be a little bit more because, again, if they can see 7, they want to get a fee for 2, not 1. So
How does this medical integration model fundamentally change like your revenue and your business model? Because like I know prior to this, you worked as an associate and then you opened your own practice, built up what I assume is a traditional chiropractic practice where like you're probably doing care plans or adjustments or something of that nature, which is like the primary driver. How have things shifted, and I already know it's been worth it, but like, yeah, how has it shifted and like what were some of the lessons there?
correct. Just kind of going back a little bit. I did worked as an associate for 2 years for somebody else in a very, very like-minded practice. We did decompression therapy, chiropractic, and physical medicine. Not physical therapy, but physical medicine. So when I started my own, I modeled that exactly like the practice that I'd worked at. I love that type of practice. I'm a former athlete, and the physical medicine aspect to me, the muscle work, the rehab exercises is absolutely necessary for somebody's recovery. So I built that from 2012 to 2018 by myself, and then hired an associate. Oddly enough, end of 2020, during COVID, hired my second associate. And then we had some changes in there, one left, and then I hired another one. And then, so there was 3 of us in an office where we were busting at the seams. So I decided to move. And when I moved, one of the previous ones, wife got pregnant. She wanted to be closer to home. So they decided to move closer to her hometown. So then there was only 2 of us. Decided to bring in the medical integration as my friend, brought it up to me. Initially, of course, just to add more services, more revenue stream to the office. And now I have a different view of it now that we're in it and doing well, and the growth aspect of it. I think, and I believe, and I see that it is my ticket to early retirement. Whether that be that I am going to no longer see patients or cut down, which I already have cut down a lot, and the associates helped with that. But there was a time when we were growing the medical that I wouldn't couldn't take any new patients because I was having to focus my attention on the medical growth, which is far more profitable. And now that we're streamlined on that and I know more about growing that, I'm taking new patients again at a higher rate. So that's paid off as well. And my personal numbers have gone down. So I feel less busy, less rushed, less stressed. And long term, I could do several things with this. Again, I could no longer see chiropractic patients and manage the office. I could split the practice back into chiropractic and medical and sell one or both. The medical practice would be more valuable selling it on its own at a higher multiplier. Or I could sell them both together. That was somebody that was maybe a chiropractor who was interested in having an integrated practice. But an integrated practice would be far more easier to sell than a chiropractic practice practicing on my own. So in a sense, it's opened up a lot of opportunities for me to, number one, enjoy more freedom of time and money. And number two, looking at the future going, okay, I've got a little something on my hands here that is going to be worth a good amount of money to sell when I'm ready. And I'm not ready right now by any means, but I know that when the time comes, it'll be worth more than a chiropractic practice by itself.
Correct me if I'm wrong, but this sounds like a classic scenario of supply and demand, right? Like one of my favorite like business marketing pieces of advice, I guess you could say, is people always talk about like what is the most important thing in the business? Is it the product? Is it the service? Is it the team? And like my understanding at business at its most basic level is it's a starving crowd or a starving audience, right? Like you can have the worst hot dogs in all of New York, but if you're outside of a busy bar at 2 a.m. when everybody's starving, you're going to sell a lot of hot dogs. And the way I pair this to what you're doing is that, again, it goes back to supply and demand, is that having this extra layer of having an MD, which allows you to provide services that a lot of other chiropractic clinics can't provide, means that you can also charge a premium price. And it also means that people are probably travel a little farther to see you. Like there's just a lot of advantages to basically doing something that most other chiropractors, for the most part, can't or won't do. Again, correct me if I'm wrong, but I feel like that's what I'm seeing in this scenario is like you must not have a whole lot of competition, if I had to guess. Not yet, anyways.
Yeah, no, within my area, there's nobody that's doing what we're doing. And kind of to restate what you said, we have a much wider reach now because we can service people, especially with the medication stuff, the medical weight loss, the testosterone replacement therapy outside of our extreme local market where they're willing to drive to our office 2 to 3 times a week. These people on the peptide therapy program, testosterone therapy, medical weight loss, they might have to come in once a quarter and just for a reconsult or a new lab. And it's really that simple. So competition wise, yes, there's competition for medical. Yes, there's competition for chiropractic, but when we talk about all under one roof, people really like that. There's obviously as chiropractors, we all know that there's people who come in very acute, severe pain, and I always felt very bad for. Who wouldn't feel bad for somebody in a lot of pain? But mostly, I felt bad because I couldn't do anything for them in that moment because they were in such acute pain that I would probably make it worse if we're honest with ourselves. So I would refer them down the street to the urgent care. Hey, go down here, see if they can help you. Come back and see me in a day or two when things calm down. Now I have that right there in my office, and so it's a one-stop shop, and we've been able to provide some of the medical services to our chiropractic patients at no additional cost because it really, like B12 injections, let's say, like B12 is great for energy, many other things. And so we provide all of our chiropractic patients a free B12 shot once a week with their chiropractic visit if they choose. They don't have to, but it's available to them. And then they also know that kind of opens the door to, hey, these are the other services that we provide on our medical side.
Reminds me so much of like a dentist practice. Like I've said this a number of times of like the parallels between the business models of dentistry and chiropractic. This seems like one step even further where like, cause I was just, the reason I'm thinking of this is like, I was literally just at the dentist the other day and they're like, they clean my teeth and do all the things they normally do. And then they're like, oh, by the way, we have this fluoride schmear or whatever it is that we can like spread, but like insurance doesn't cover it. It's an extra like $50 or $60 or something like that. Like a nice little like gentle upsell. And I'm like, man, that's so good. Like this is the best time to do it because we just cleaned your teeth. But anyways, I just love the parallels between those industries. I'd love to, where I want to go next is you alluded to it briefly, is I want to tap into the marketing side of things a little bit. So how do you market a medically integrated practice versus I guess a traditional practice? Like how are things different? And I know this is a subject that you're pretty averse at in terms of like knowing how to do good marketing. So I'm curious as to like what do you see as the differences?
It's the same approach, right? So getting the word out in your community first, and usually that's the cheapest way. And I feel like that's as a poor chiropractor at one time in my life, that's the only thing that you can do because you don't have any money to put behind your advertising. So you get out there and you do the Chamber of Commerce and you do this and you do that and you get involved with people that can spread the word. So of course initially that's what we did, and I have I'm huge on email marketing. Like if you're a chiropractor and you don't have MailChimp and you don't email your people, your list once a week, then you're nuts. So me emailing my chiropractic list about our new medical service created the biggest boom for our medical services I ever could have imagined. Everyone was interested. Everyone came in when we first started IVs and, oh, how much can I do that for? And of course, we ran a huge discount in the beginning too. So marketing to the people that you already have is huge. And then getting out there in the community and letting people know what you have. I've taken flyers and cards and things like that to places for, let's say, testosterone, where I know that men go, right? Barbershops and jujitsu gyms. And there's a place called Power Fit Eats that they sell healthy pre-made food. Okay, so healthy people, what do they want? They want to lose weight, they want to put on muscle. So we're offering medical weight loss, we're offering testosterone replacement therapy for men. Of course, I have my card sitting right there on their front desk. So those are ways that I got out and made people aware of our new stuff. And the other is social media marketing. I'm big on meta ads for our medical stuff and Google ads for our chiropractic stuff. I do feel like for chiropractic, I do want to be up there on the top for the chiropractic ad when people are looking for somebody specifically in the moment. I want to be on the top of Google. Medical, I don't know that people search where can I do medical weight loss. They don't necessarily know that they're even interested yet. But when they see it on social media, like, oh, hey, drop 20 pounds, blah, blah, blah. Like, oh, click on that. Oh, okay, I can go in for a free consult. That's cool. Let me schedule that. And we're not going to get every person who signs up for a free consult, but it's worth every penny. Same with the testosterone replacement therapy. We're doing that on Meta as well. Tried a bunch of different things. What I find works so far, again, is, you get them with a little bit, give them something free. So we're doing a free testosterone check. If it comes back low, we can run the full panel. They pay $100 for that, which is also super cheap. And then they would come in with the nurse practitioner. So my ads on Meta are more targeting symptoms, low energy, low libido, grumpy, not being the man you once were. I had low testosterone. I didn't even know it. I was the first patient and my numbers were 340 and they should be anywhere between 800 and 1200. And I was like, oh shit. Okay, well, I'll give it a shot. And I've been on it since September of last year without changing anything at all. I've lost 10 pounds of fat and gained 8 pounds of muscle. And I haven't changed my diet and I haven't changed my workout. I work out twice a week, by the way, twice for 45 minutes each. So my own personal testimony also goes a long way when it comes to marketing, because I can sit there and talk to my patients while I'm treating them, especially men, about these kind of things whenever we have similar goals in life and health. These people that come into our chiropractic offices, they want to be healthy. That's why they're there, but they want to be healthy in all aspects, not just their spine, right? So the marketing part kind of comes easy when you put all of those pieces of the puzzle together.
Yeah, I mean, it sounds like it expanded your tool belt. It sounds like having more, yeah, it sounds like having more services to offer on some level actually makes the marketing a little easier, because like you can target specific problems or challenges based on the uniqueness of like, where is it at a gym? Is it at a food place? Is it on social? Is it on Google? Like they're all going to be different buyer personas. And this probably allows you to like target depending upon what their challenges are.
Absolutely. And I've always been somebody that's like hungry for more. Doing the same old thing every day is boring to me. So learning these new things has been enlightening to me. It's been fun. I'm ready to talk about it. I'm ready to, promote it and help other people. The benefit that I've gotten in a year is amazing. And I think every guy over 35 years old should know their testosterone levels and, and benefit from from testosterone replacement therapy if they need it. But, that's just because I'm excited about it. I think everybody with a back problem should see a chiropractor too. So I don't want anybody to think that I'm, not doing or enjoying chiropractic anymore either.
I'm 37. I'm trying to think if I got tested recently. I think I was in the 500s, maybe something of that sort.
Yeah, that's not bad. So pretty much anybody under 600 is treatable through testosterone replacement therapy. But it's a personal choice. I do think, though, that everybody over 35 should at least know their numbers. And you can we're advertising for a free testosterone check, and there's other companies that are doing the same too. So a lot of these places you can just walk into and have it checked, and then you'll know.
Don't get me wrong. I definitely want to. I'm just postponing this as long as humanly possible.
And I agree with that. I agree with that. It's when you do it, you feel so dang good that you're like, the first question anybody asks us is, well, if I start, can I stop? Like, yeah, you can, but you feel so damn good. Why in the hell would you want to? Like, it's no. So sure, yeah, delay it until you really feel like you need it, that you're having all these symptoms, and then when you jump on, you're like, yeah, I'll stay on this. This feels great.
Yeah, I'm dreadfully aware of the Pandora's box of that. I obviously have friends that use it, and I'm very familiar with it, just in general. Because like I've been on both ends of that spectrum of like having, even when I used to compete in bodybuilding shows, and my T levels would plummet, and you just feel awful all the time. And like this, so I know what the other end feels like, is like when it's higher and you're feeling really good and you're at a good healthy weight. And so I'm very aware. I just, but anyways, so I want to dive into staffing a little bit. So what's like maybe the single hardest role or position to hire in terms of staffing, and like how do you keep them around? How do you attract this talent? Let's talk a little bit about the staffing for a practice like this.
So the hardest role that I've always had a problem with is a good front desk person. I have a girl who's worked for me now for a total of 5 years, and she had a pregnancy leave, and she is amazing, and she started off as my front desk person. But she's grown into a much bigger role than that. I hired another girl that also started off as a front desk girl, and she also had medical assistant certification. So she's more pulled in that direction now with our medical stuff. And so, the front desk is such an entry level position, and they can be great or they can be terrible. And I feel that when you find a great one, it's hard to keep them, because they can go work front desk somewhere at a medical office, making a lot more than they can at a chiropractic office. And once they have that on their resume, they're more hireable. once they've worked front desk at any office for a year or two. So that's been the hardest one to keep. I've kept the two that I have now by moving them into a higher positions and paying them more and giving them more responsibilities. And they both tell me that neither one of them want to leave, which is phenomenal because they're huge assets to my business. Front desk though, it's, they come and go, some for better reasons than others. We lost one. I've lost a few to, their spouse, let's say, or they've got married, they're moving, their boyfriend's going to college over here, so they're going to move with them. So that's been the hardest position for me to keep.
Yeah, I'm not surprised, to be honest. You generally see that for most entry-level positions. The challenge with that one, though, too, is that when I talk to most doctors, is that it's arguably one of the more important positions because like they are your sales team at the end of the day. Like if they don't properly know how to greet a new patient or to take a phone call or to respond to an email, it's like that's missed patients, that's missed leads, and they're on the front lines of making that stuff happen.
Absolutely. And I do lean on the other two for that a lot. I can 100% depend on them for anything. I also depend on them to teach and coach the new girls through that. Some of them just don't learn as fast as others, or maybe some of them don't want to learn. They're just there to sit there and schedule appointments and move on with their day. To me, it comes down to, again, so I hire for character, not really what's on the resume. Of course, that kind of gets them in the door having a decent resume. But during the interview process, I talk a lot about characteristic traits, what they would do in certain situations, what they do for fun. I want to make sure that that person and that personality aligns with our office. So that's usually what I'm after. And sometimes I've found that people can put on a front or an act for the interview. And then within a few months, their true self might come out, or their laziness, or their they're not committed to the job, that kind of thing. But that's definitely the hardest part to fulfill.
So where do you see the future of medically integrated practices going? Because like I said at the beginning of this conversation, it's something that's relatively new to me, to be honest. And honestly, I don't really hear a lot of doctors talking about it. You're one of very few that I've ever even heard mentioned it. So I'm curious as to like what you see moving forward. Like, do you see more chiropractors going that direction? Do you see this becoming more mainstream? Do you see it becoming more regulated? Like what do you anticipate?
Yeah, so the profession, I believe, is split 50-50 and straight chiropractic versus what we would call mixed chiropractic. And during my education, a mixed chiropractor was somebody who mixed with physical medicine, rehab, soft tissue work, whereas the straight was chiropractic only. I would never expect a straight chiropractor to have any desire to integrate with medical, but I think those chiropractors who had the ideas of being a mixed chiropractor from the beginning would lean more that direction, because again, you kind of want the best, you want to do the most for the patient. I think as chiropractors, we all want the best for the patient. The mixed chiropractors, I find myself wanting to do the most for the patient. So adding the medical integration offers more for the patient, more for the overall well-being. Nobody wants, of course, anything bad for the patient, but I think the future is the people like myself who are willing to take the risk financially to medically integrate and have the creativity to add specific services to their office that can add to their arsenal of things and not overlap. Like I was saying earlier about patients coming in and having to see the nurse practitioner first and then see the chiropractor. You're just adding another layer. You're not diversifying the practice. So in the future, I think some of these practices will become more diverse and maybe take over larger areas. and take over some of the smaller practices. Maybe even engulf them and say, hey, you come work for us now. You do chiropractic in our medically integrated practice, and we will have more to provide for you as far as stability. I have a former classmate working for me now, and she had her own practice, and let's be honest, it's a tough field for females, and she was pregnant, and she owned a CrossFit, and she owned her chiropractic practice, and rent was going up, and staffing's hard, marketing's hard. So she joined my practice. We provided her time off to have with her child and maternity leave, and she brought her patients, and now she gets to come see her patients, and she gets to go home to her child at the end of the day. And I am more than happy for her that she has that freedom now, and she has the staff that I provide to her to back her as a doctor. And I'm elated to have her in the office. And from what her and I have spoken about now is she has higher take home pay than she did trying to do it on her own and pay the rent and pay the staff and do all the other things, working from 6 a.m. to 9 p.m.
Everybody starts a business thinking that they're going to get all this extra time and freedom, and then they just end up working 80-hour weeks for 5 years before they ever get any of that anyways.
And I did not take a vacation other than a national holiday from 2012 to 2018 when I hired my first associate, and I took my first real vacation. My son was 6 years old. My daughter was 5. And then I had another one in 2017. So the other one was fairly new. That was the first time that we ever took like a family vacation. So yeah, people think, oh, I'm going to do this and I'm going to own my own business. But sometimes we become slaves to the job, and it's easy to do because you're constantly chasing the next thing, the next dollar. And you got to be there. When my son was born, I felt so thankful because my wife had him on like a weekend, like Saturday or Sunday. And I was like, oh, great. I didn't miss any work for this. We got released and came home, and I made sure she was good with my son and all that. Good, you got everything you need. Okay, I got to go work for the afternoon. I went to work on the same day my wife and son came home from the hospital. With my daughters, I stayed home for the rest of the day, that day that we came home, and I went to work the next day. I mean, I knew if I didn't go to work, there's no income. Who's going to pay for the kids, right? Who's going to pay for the house? So, yeah, it's easy to think that I'm going to be a business owner, but there's a lot of reality checks along the way.
Yeah, everybody just sees the tip of the iceberg. They don't see what it took to get there. They don't see the climb. As we wrap up this episode, I think we've pretty much drove home the fact that like obviously having this type of practice, the integrated medical practice, is beneficial for so many reasons, from business model to hiring and talent and being super profitable and eventually maybe sellable. I'm just curious as to like, so let's say the listener is like, okay, this sounds awesome. Maybe they're motivated to move this direction or energized by the fact that like this is a potential future for their practice. What's like maybe a misconception they have about this type of practice that we can maybe eliminate? Or if you want to take the other side of this question, is like, what would be your, I guess, best piece of advice to them as they kind of start moving this direction towards an integrated practice?
So probably the misconception would be that maybe it's not worth it up front financially, or like when you and I discussed in the beginning, what is the medical doctor's stake in the business? Some people might think, oh my God, he's got 5% of my practice. I'm not giving up 5% of my practice. In reality, they don't have anything. So those would be two potential drawbacks that I've talked to friends about already, and I don't have the funds for that, or wait, I got to give up part of my practice. The funds, yeah, I have to be there, but you can do a little at a time. I had my first nurse practitioner for 1 day a week for 9 months. And it took maybe 3 months to become profitable, but eventually it did. And now Yeah, I wouldn't have it any other way now. Advice I would give would be, again, all states are different, so you need to look up a healthcare attorney in your state and just contact them and say, hey, I'm a chiropractor. Are we able to have an integrated practice where I'm the majority stakeholder in the practice in this state? And if they say yes, go through with it. I mean, if you want to talk real numbers, it cost me $5,000 to get the contracts going with the medical attorney. So, I mean, that's not terrible. You can start that, and then you got to get a medical director. That would be the first steps. Find out if it's legal in your state, to do it the way that I did it, because I think there's a way to do it in every state, but there's just different ways to do it, right? Healthcare attorney can answer that question. How much does it cost? And you got to find somebody that you want to work with. Thankfully, my first nurse practitioner was one of my best friends, and then of course he had to go back to his full-time job at a hospital. He wasn't. I'm so thankful that he was willing to give me one of his days off out of two. He gets Sunday and Tuesday off, and he worked for me on Tuesdays for 9 months. So find a nurse practitioner or a PA, would be the second step for action plan.
Joe, what's your plug? Where can people find you? What's the best way to reach you?
Yeah, best way to reach me would just be my email, which is drjoedenke@gmail.com, drjoedenke@gmail.com. I'm on Facebook, personal Joe Denke, business Select Spine and Sports Medicine. Instagram, same Joe Denke and Select Spine and Sports Medicine. Reach out if you have any questions. I'll certainly be happy to answer and help you out any way I can. I think that's why we're all here as chiropractors, really, because we want to help people. I'll help somebody find directions to the grocery store. I truly like helping people. So I don't find it to be a problem that somebody asks me for help.